Welcome to the Kingston Board of Health meeting, November 17th. We were supposed to start at 5 o'clock. We now have a quorum at 5:03. We have George Collins here on behalf of a variance that's being presented to the board today. And let's take him first so he can move on with his evening.
Good evening. For the record, my name is George Collins from Collins Civil Engineering Group. I'm a registered professional engineer representing Philip DeCilio at 94 Elm Street for a septic upgrade. We are not upgrade, meaning we're not increasing any design flow. It's an existing home. Would I be able to share a plan?
Oh, yep, I have them,
We
George.
have the plans. Do you want to share it so you can point something out to us, sir?
Let's see here. I mean, I guess it's not totally necessary, but let's see.
They're gonna let him share.
Or if you're okay with it, I can just explain it to you. I mean, yeah.
Oh,
Okay.
there we go. We
No,
can
we
see
had
it.
it. And here's a paper copy.
Yeah. So basically, if you like, I can keep on moving forward. So basically, this property is located on the east side of Elm Street. So you got Elm Street here. You got the existing 3-bedroom house here. And then something to be aware of is there is an off-site wetland right here. This is the wetland line here.
Okay.
We had that delineated by a wetland scientist. This orange line is the 50-foot buffer zone to the wetland, and then this purple line is the 100-foot buffer zone to the wetland. So we have everything is outside of conservation jurisdiction. Let's see here. And what I have proposed here, these two red lines, though, that's 2 rows of straw wattle, which we use as a work limit to make sure that none of the soils or none of the work will accidentally go into conservation jurisdiction. So basically what we did is we went out and we dug 2 holes and a test pit here and a test pit here. And when we dug down, we immediately hit groundwater just a couple feet below the ground surface. As a result of that, we ended up collecting soil samples for in lieu of a percolation test. Typically we try to pour water and go through a conventional percolation test process, but due to wetness, we had to collect a soil sample. So that is one of the variances that we're before the board with. And then the other thing that we're requesting is a water table separation reduction. The code requires a 4-foot separation from the bottom of the septic system to the seasonal high groundwater, and we're requesting a reduction from 4 feet to 3 feet. What it is the plumbing comes out under the basement slab, and we cannot change that. So in order to make this work by gravity, we had to request the variance, lowering the system by 1 foot. And then another thing to be aware of is that we are not in a water protection. This is not a zone 2 water protection district. Sometimes if you're in a water protection district, lowering the system by 1 foot might be a little bit more of a concern because it's in a water protection district, but this is not in a water protection district. So again, we're requesting we call them a local upgrade approval requests. And they're basically just kind of pre-staged variances through the state. Again, for the use of a soil sample due to wet soil conditions, and then a water table separation reduction from 4 feet to 3 feet, which will allow us to make the system work by gravity without putting in a $5,000 pump. I'd be more than happy to answer any questions that the board, agent, or public may have at this time.
I think it's what you have here is preferable to a pump because electricity fails, gravity doesn't.
Yes, yep, absolutely. Yeah, and these people have been here for a really long time, and I think they should have fixed their septic a while ago, but they're not moving. They just knew it's something that they had to deal with.
Is there a deed restriction on this house?
No, not to my knowledge. They're not looking to increase, and I can tell you from having walked the, property, it's it's high up and the wetlands are very low down, so it seems like it's water running down their property, which is why they did the sieve analysis instead of a percolation test, so. And there is the slab, it's an old house, so the moving of the sewer that comes out of the house would be a monumental task.
It's on a slab?
It goes under the basement of the house.
Oh, yeah, that's pretty.
Yeah.
This is
You have to see
basically,
this place.
basically a walkout basement, so there's really no foundation for us to come out higher. Sometimes we'll manipulate the plumbing and come out at a higher elevation, but we can't do that with this particular setup.
Without putting pumps in.
Yes, without putting in a pump.
Yeah.
Yep, I'm pretty familiar with the pumps.
Fun time.
Okay, so can I see the variance? Because I didn't see anything on the variance
Yeah.
about the,
Yeah.
The sieve analysis.
Yeah.
Right.
Yeah, there's a DEP policy. It's the variance number 2, allowing a percolation rate to be established by grain size distribution analysis, which is basically a soil sample or sieve analysis. Let's see, I think I can find that.
because all this variance is reading, it says nothing about,
George, you see it on what you sent us?
Yeah, yeah, if you look right here.
Points it out.
is it under number 1? Is that what you're saying, sir? The variance
number-
from
if you look-
section 310 CMR 15.12, 212 of the state sanitary code, which requires that the minimum vertical separation from the soil. This, I'm not seeing anything about on this variance about
The sieve.
the.
I mean, this is it, right here,
I
this
just-
is it on the plan.
No,
Oh.
but it's not on the variance.
And then I have the paper, I have the variance letter in my hand that that we requested. I don't know if we can see this, but
Okay, hold on. I just want to make
Okay.
sure we're taking care of
Yeah, no.
all at
if
once,
you- if
George.
you- this is
And
the,
it's- I've never seen anybody go through for a sieve analysis.
the
They usually
variance
just stamp
letter.
it on the plan.
Oh, okay.
Okay. So can we amend this? to
But do
say
do we
that-
need to?
I don't know, George, well, I'm not sure, I've never seen anybody put through a variance for the sieve analysis, they just usually note it on the plan, which I know you've already done.
Yeah,
That's something, like, I've never seen one come through, we're more than happy to add it on.
yeah, I mean, and again, it's not, and just to be technically corrected, it's not even a variance, it's what they call a local upgrade
Local
approval.
upgrade, yeah.
Which are basically kind of like pre-staged or pre-approved variances that the state set up that can just be approved by the towns.
Right, and that, but that usually is through me, not through you guys.
Okay.
And I got no
I
problem
just-
with the sieve analysis, I was on site when I saw, the
Okay.
conditions of the soil.
Okay.
So, yeah, that's why it's not on the, because it isn't really technically a variance, it's a local.
That's
upgrade.
why I was just trying to
Okay.
make sure we're taking care of everything, one
Yeah.
fell swoop, that's
Yep.
all.
Yes, yeah.
Okay. Anybody have a motion?
Okay, so Joyce, do you have any other input on this?
So
I
if
mean,
we
I'm
make a
not
motion,
familiar.
then we,
Oh, okay, okay.
Yeah, I
Okay.
move to approve.
the
Okay.
variance as
The variance is
requested.
presented in, the letter is accompanying, whatever.
Okay, and I second that, yes, okay.
And now
Yeah,
your
okay,
question.
yeah. So do you have anything else to add on this?
No, I think
From
it's,
your professional opinion here?
no, I think this is
Okay.
the best solution for what the situation and the topography of the land is.
Okay.
Okay, all in favor?
Aye.
Aye.
Thank you very much for your time, and
Thank you for your
Mhm.
time, sir. and I'm
Joyce is
sorry
a
about that
pleasure to
little
work with.
confusion.
She and I worked in Milton together, so
Oh,
you got a good one.
great.
And Laurie too, she's excellent, so you have excellent staff there, and they're
Mhm.
great.
We are
work.
very
Yes.
lucky.
Yeah.
Thanks,
there
George,
you go.
we'll send you the
Okay.
20.
Appreciate it. All right, take care. You guys have a good night. God bless.
Bye.
Okay.
Ladies first.
Yes,
Oh.
usually, just so you
And,
guys know,
well,
we don't go upgrades, we don't usually bring to you guys. I think he was just
Okay.
being extra project.
Okay, yeah, okay,
He's very by the book and
Uh-huh.
diligent, so,
okay, well, that's what we like.
yeah,
Yeah.
can't go wrong with that.
Okay, if we've passed around the bills, we could send those over to Dennis. And
There you go.
1 minute I was late.
3 minutes.
3.
No, it's actually, I got here, according to that clock, 5:01. Oh,
I don't know.
sorry.
If people would like to take a moment and review the meeting minutes from October 20th as presented. You split your screen. I don't know how to do it on yours. I know how to do it on mine. Good. Go to view, maybe go full screen.
Where do I see that?
Uh,
It is on full screen. I don't know if that's there.
Can you move it?
does it really matter?
Yeah, don't worry about it, Lori.
It's not recording it, so don't worry about it. Lori, I really appreciate you sending the minutes in the email because it makes it easy.
Oh, okay.
Thank you. Thank you. You're all set with these, Dennis?
Yeah.
Thank you.
Make a motion to approve the minutes of October 20th as presented.
Okay, second.
All in favor?
Aye.
Aye.
Aye. Okay. Do we have anyone here from Suji's Kitchen?
No,
Okay, I say we move on to our health agent report then.
okay. So health agent report, meaning Lori and I attended the MHOA conference last week. There was actually some really helpful and valuable classes. We got to speak with the Tobacco Control Commission. And you get some guidance on good standard procedures. We will be continuing to use Bob Collette as our main agent for ensuring people are complying. Also attended a fats, grease, and oils talk. Plymouth instituted it, and it's probably something that we need to look at to come up with. DEP has guidance on it, but we may want to investigate it further, but that's after the New Year project.
And it's fats and oils in regards.
Fast oils increases, like what's being released into septic or sewer, and it's mostly for commercial properties. But overall, the conference was, useful. We both, and we went to different things for the most part, so that we're working on helping Lori get some more education in the different areas of what we do, so that hopefully if the new position goes through, she'll be that much closer to being ready to be fully utilized. The other discussion issues are permits. So the high school, Silver Lake Regional Schools, both the middle school and high school, predominantly occurs at the high school. The middle school could potentially have a booster club that did something at the high school. I have been working with the principal as well as the head facilities director to come up with guidance and solutions around this, because they have a booth at the football stadium, but it doesn't have running water. And so there's some parameters that we need to follow to make sure that the food's safe. So what we came up with is to do a once-a-year permit, much like we permit the kitchens in the schools and the culinary arts program, that they will receive a permit that covers concessions for the year, for the school, for PTO, boosters, the library club, the automotive club, whoever the students are that have these clubs, or parent-student groups.
School run.
Yeah,
Mhm.
school run, it's
School
only for
run.
school groups. That they are covered under this permit to sell prepackaged foods or commercially produced foods. So they can go to Chick-fil-A and buy pre-done sandwiches, or the local pizza shop, or subs, that's okay. But we've come up, the principal and myself, we've gone back and forth, we have guidance documents of wearing gloves and what you have to do, and labeling food, meaning times that it can only have it out for 4 hours. So we really looked at ways to make this as easy as possible, to facilitate them being able to sell food and do it safely. They can't bring stuff in from home, they can't cook food on premises.
Mhm.
So I'm just looking for the board's permission to, we've working on a template to get a permit to the school that will cover that. And there'll be, we had agreed that 50, but I think given that we don't charge, it's like we're charging ourselves, it seems
Right,
just
yeah.
permit and make sure that each event, anybody who's
Uh-huh.
holding event needs to fill out some paperwork and just submit it to us, but no cost added. They just need to make us aware of the event. So
So do
that's
they
what I'm.
need to make you aware every time they're running the concession stand for the football team?
No, it would be more like, football will run concessions September 30th to November.
And
This
then
group will be
figure
doing
spring
it.
Sports.
Yeah, and then like if, the library club is holding a food sale at an event, just who it is, so we know what group is doing it. And because they all have organizers and they're all gonna have to fill out for the school, so it's a matter of them just emailing us. There's no, it's
Okay.
just to keep track of who's doing what. So that's the first one.
Mhm.
The second one, well, do we want to act on that one
I
first?
think we
before-
only have 3 people here right now
Mhm.
to make a motion to be for a fee to be charged,
Not charged.
not charged.
I don't think we
Yeah.
need it. I don't think we need anybody else here for that. I mean,
No,
And we already don't do it for the rest of
I
them.
mean.
I don't think we need to do it. I would prefer not to
Yeah,
charge.
Okay, so then
pretty
that's-
Yeah,
benign routine business. It's not a.
okay, yeah.
So do we need to do anything,
Do
or
we
I
need to
just,
make a motion? We need to make a
I'll
motion
just make
then.
a motion for the record.
okay,
Do you-
Make a motion for, to approve the, what is it? It's not fee, it's a license,
the
permit.
non-feed permit for the school,
non-fee permit for the schools.
for the concession stand.
Concession stands and food-related sales
That's
on
school-
at school events.
on
I
school
move the
property.
board adopt as policy the health agent's recommendation for
Perfect,
non-fee permit. Have the exact language of your recommendation.
okay, all right,
All right, second that.
all right.
All in favor?
All right,
Great, thank you.
Nicely done, Dennis.
Okay, so the next thing is,
Can you go back to the fat oils and grease thing?
uh-huh.
So is that something that we don't typically do?
No,
Like have
so-
grease traps already?
No,
Okay,
DEP
I don't
does
understand that.
require grease traps to be installed in plumbing in commercial
Uh-huh.
situations. Many towns are, I'm just telling you what other towns are doing. I'm not
Okay.
saying that I want to
Right,
do this.
okay.
Just put that right
Yeah.
out there. Requiring commercial properties to upgrade to external grease pumps that generally sit outside of the facility,
Ah.
that hold, it's usually a 1,500 gallon tank.
Uh-huh.
And there's pumping requirements. There are like Plymouth does this.
Mhm.
There are variances, like there are some restaurants in Plymouth that literally cannot do it because
Yes, they don't
They don't
have
have a space.
for a
Yeah.
multitude of reasons,
Yeah.
but so there are variances and there are apparatus that can be installed, both passive and active, grease traps that go internally inside of the establishment.
Mhm.
So it's just something I think that down the pike, it's not anything, because we don't have that many facilities. It's not something we need to do immediately, but we should look at it and
Mhm.
think about how we want to progress going forward.
Mhm.
And how we work with pre-existing businesses to just make sure that the grease traps that they do have installed are adequate for what they're producing or
Mhm.
not producing, and that it's, ensuring that we are not clogging sewers,
Right.
because generally it's sewer related.
Right.
The sewer system, I can tell you in Milton, that was a huge issue because and they can track where the grease is coming from.
Right.
And it really does wreak havoc.
Right.
So like I said, it's not anything that needs to be done, but it was good to go to the conference in that
Mhm.
particular segment, because I think it is something that as our sewer expands, we probably are gonna need to look at, and so
Right.
it's easier to get in front of things as the potential for development becomes more prevalent.
Mhm.
We should have those things in place that as new things come up, this is what's
Mhm.
required, not so much worrying about what's pre-existing.
Yeah,
Mhm.
But again, that's something for after the new year. I'd like to just
Yeah.
get through permitting season.
and maybe at that point also remind people with their septic systems, what we don't put down.
Right,
septic
well,
systems.
yeah, we've been actually, Lori and I've been talking about, trying to do programming for that, like to educate, town residents about septic and like, what do you do? What are you looking at? How does it work? That kind of thing. So people are like maybe a little more knowledgeable about
You
how
might do-
things work.
To Janet Wade and do a healthy Kingston.
Mhm.
Yeah, no,
on
that
it.
was
That would be, we
an
could do
easy peasy way to get them.
Yeah.
info
get the
out.
message out.
Mhm.
So, again, that's an after the new year thing.
Yeah, no, I'm
Yeah,
just.
we're just
great idea.
We're trying to hold our head above
I
the
know.
water.
Just number.
Ours shouldn't be too bad, because didn't we roll a lot of them so that they were staggered through the year?
Some, but this is the bulk of them.
Yeah.
So all installers, all the food establishment tobacco, those are the biggest ones, and they are also the most complicated ones. So just, a lot of due diligence to make sure people have turned in their stuff.
Speaking of tobacco licenses,
Yes.
do you
Oh,
have an update for us?
yes, we do. So we received word back from town council that the two outstanding fines for Quick Mart, one located at Summer Street, one located at the mall. Because both of those businesses are now closed, excuse me, I have the hiccups, are closed, town council is saying we would not be able to go and collect on those fines at this time, but the businesses are closed,
Mhm.
so. It's kind of a non-starter.
Okay.
And the last thing I have is I'm looking to come up with this is cookie selling season for troops.
Right.
And so we permit for everybody who does, even commercially produced foods. So like, to give you an example, we have Simply Tasteful,
Tastefully simple.
Tastefully Simple, sorry.
Okay.
Boxed product, it's,
Uh-huh.
nobody's making anything, comes prepackaged, the lady takes it out and sells it.
Okay.
She pays for a permit. We have people that do salt and herbs, we have people that do commercially produced sauces, oils and vinegars. All of them are required to have a permit. Now, I don't think it should be the same exact as that, because we're talking about a troop of kids that are selling this. I am looking at putting together a yearly permit for troops that allow them to sell in the town of Kingston for whatever the duration of their cookie sales are, to make it simplified and easy and cost effective for the troops, because the troops are paying for this, and my understanding is that out of a $7 box of cookies, the troops get $1.
Girl Scouts of America take quite a bit of money
Yeah.
off those. equipment.
So I would like, for right now, to get us through the month of December, I would like to request that the board approve a $10 permit fee for the month of December to cover the Girl Scout troops to sell cookies in the town of Kingston. And then I will look at, because they're not gonna sell them in January, and then I will look at,
Why don't we make it a 3-month? For $10 to cover the Girl Scouts.
okay, that's, I could care
Because
less.
that would push us
Anybody
through.
else?
And
or-
basically gets us.
Well, no,
through February.
it goes by troop, Boy Scouts, Girl Scouts.
Yeah, I just expanding the scouts.
Yes,
Yeah,
because that will get us through our high
February.
season of permitting.
yeah,
And it will let them sell their little heart to their heart's content. And they
Right.
can come knock on my door.
get those thin mints, bring me some. But yeah, so let's,
Yeah.
that's fine, and then that gives me some time
That's
to
what I'm
put
saying.
something together that
Mhm.
seems, I want to make it fair and equitable, but it is that agreeable to
Yeah.
everybody?
So are you
Yeah.
talking about a $10 permit for the Girl Scouts, all of them, not just each little?
Well, that's what-
group?
This, for December, it would
Yeah.
be whatever troop wants to sell in the
Oh, so
town
the
of Kingston,
individual
it's
troop.
$10 for
Okay.
December, January, February.
Yeah.
Okay.
I would like to see it
Yeah.
become, because the
Uh-huh.
Girl Scouts of America, Boy Scouts of America.
Yeah.
They have such,
Low
wide-
profit,
yeah,
Uh-huh.
the troops aren't getting a lot of the
they're
money.
not.
So if we could blanket it to cover like maybe a $10 fee for all of Girl Scouts and a
Right.
$10 fee for all of Boy
I don't
Scouts.
prefer that.
Yeah, that's what
Yeah.
I mean, right?
You know,
Right.
for each individual organization.
Right.
Yeah,
rather
so, like,
than-
I know
We'll
that they
cover
have
all.
like,
Yeah.
what do you call it? Like, an area coalition that covers like, I think, I've been talking to a troop leader who
Uh-huh.
did the right thing and came in and was trying to do do the right thing.
Right.
And I know that there's a Plymouth like head group and that they oversee, like if they control Plymouth and Kingston, maybe somebody else.
Well, even like the Duxbury Girl Scouts will sell at Big Y or outside Target. You know what I mean? You'll get the, so.
So maybe it's like I can talk to her about like each area coalition buys a fee for the year.
That would be, I would be really,
I just need something to get me
Uh-huh.
through the next couple of weeks.
yeah,
or
so let's
months.
get
Yeah.
through the next 3 months.
Right.
That the Girl Scout troops or Boy Scout troops, so should we say local clubs or
Yeah.
local troops? What do you think, Deb?
Local,
Local youth organization.
yes,
Perfect.
Ah,
I
yeah.
knew you'd have some good
Yeah.
words
yeah,
for us.
local
Okay.
youth organizations,
A $10 fee to cover the sale of goods
okay.
Uh-huh.
per
And
organization.
it's gotta be commercially produced goods, they can't be
Commercially
selling
produced,
fake.
yes.
Yeah, that's a whole nother issue, so I just wanna be
Prepackaged.
very clear on that.
Prepackaged,
Prepackaged, commercially produced.
Okay.
Okay, beautiful, thank
Okay.
you. Lori, did you get all that?
Is that a motion?
I don't know, I think Dennis is.
I move that, we grant, what was the price of that?
We grant a permit to cover,
We grant $10 permit to cover a period of 3 months to all youth organizations selling commercially packaged and produced products.
great,
Yeah, second.
All in favor?
Aye.
Aye,
aye, fantastic,
done.
thank you. All right, that's all I got.
Dennis, we have you on the agenda.
Yeah, it just, with some of the craziness that has been coming out of the CDC in Washington over vaccine guidelines, I just would like to make a motion that this board will adopt a policy to follow the guidelines of the Massachusetts Department of Public Health.
I will second that.
Don't look at me, I
Okay.
can't vote.
So have you seen that?
Right, so do we need to do, I mean,
I was
isn't
gonna
it sort
say,
of
we
just
already do
understood
this.
that that's what we do?
Well, this kind of formalizes it a little bit to just kind of, so if somebody comes in with conflicting guidelines, no, the board's policy is to follow. We're not gonna say, board's policy is to follow the ones that are crazy, the board's policy is to follow the state.
He's saying
Mhm.
that we want it written down that we are following,
We adhere to the.
we're following the Mass Department of Public Health guidelines. We are not going as lenient as the federal guidelines currently.
Okay, I'm just wondering, like, isn't that just sort of inferred that that's what we do as part of the Massachusetts Department of Public?
Well, traditionally, when things are a little less crazy than they are
Mhm.
right now, the state defers primarily to what comes out of Washington. There's very seldom is there an exception.
Right. this is
Now,
unusual,
where there's a
right,
divergence
right,
between reality and fiction,
right.
you kind of had to clarify the waters a little bit.
I think we just have two differing opinions, but I should tell you that if anybody comes in to ask us, meaning myself or Lori,
Mhm.
about vaccines,
Mhm.
our answer is, we do have, now they're over, but we have vaccine
Right,
clinics, but
right.
you should be checking with your
Checking with your
doctor.
pediatrician.
Or your
Right.
Yeah,
pediatrician.
to see what they recommend, that we are
Right.
not doctors, we are not
Right.
nurses, and that we cannot tell you
Right.
what you should and shouldn't get, but that, the stuff that's recommended by DPH is the vaccines that we are working with CVS or Big Y to
Mhm.
provide.
Mhm.
So that's the guidance that we give everybody.
Right, right.
So I just want to make sure that that's acceptable to everybody at the board.
No, I think that's
Yeah.
absolutely appropriate because you always want to defer back to somebody's,
I don't know their personal history.
you don't know their personal history, you don't know, you don't know a lot.
Yeah.
You know, you
Right.
just have somebody coming and asking you the question, you say, you really need to follow up with your own practitioner.
Right,
Mhm.
I mean, that's outside our scope as members of the Board of Health to do
Yeah.
that, but the right, way to go is to have a talk with your own
Yeah.
physician.
Mhm.
If they ask a specific question about, do you like, I don't know.
No, well, I always say,
Yeah, yeah.
and people say, well,
Right.
what do you recommend? I was like, I do not recommend anything to anybody.
Uh-huh.
That's a personal
Check with your
choice and it's a
personal
decision that
physician.
you and your
Right.
doctor need to make.
Right.
I, as the health agent, have
Mhm.
no purview over what you do to your body. That's between you and your doctor, and I'm not making recommendations. I'm not a medical professional. It's not my business to tell you what you should or shouldn't get. Whether I think
Mhm.
it's right or wrong has
Right.
nothing to do with my job. That is a personal decision, period. I wouldn't feel comfortable giving anybody medical advice. I'm not a doctor.
And this is simply to clarify public policy, that's all. It's whatever our personal opinions may be, those are personal opinions.
Well, we are a branch of the Department of Public
Right,
Health,
right,
so
right.
by,
We exist
by that-
underneath that. right?
Yeah.
Yeah.
by that, we are
Right.
supposed to
Follow Mass
what they
Like,
say.
we're the community face of the
Yeah.
Department of Public
Well,
Health.
and just as we learned during COVID,
Uh-huh.
we are following Mass DPH unless we want to escalate it above
Right.
the criteria.
That's right, we can go above
Okay.
and beyond. Right,
But
yeah,
at
yeah,
this
yeah,
point in
yeah.
time, we are standing in line with the Mass DPH, I think is what Dennis
We're
is
an
trying
extension,
to.
we're an extension of them.
Okay.
Yeah, and I mean, I always
Okay.
say, if you have questions about what you think, you can certainly go on Mass DPH and they have a
Right.
plethora of information about.
Yeah, they do have
Vaccines.
they have some good information. Yeah.
I just think that's
Yeah.
the most appropriate way to handle
Mhm.
the general public.
Sorry, I have to tell my 11-year-old to eat.
So that's the motion I make for the record.
I will
Okay.
second it. That we follow, that we
Yeah.
remain in
yeah.
line with Mass DPH.
Yeah. And so would we publish this, like,
No, there's
the
nothing,
Facebook
that-
page or
It's on
something?
the,
Oh, all right, okay,
Yeah.
okay.
and then it's available, then everybody wants
All right,
to.
if anybody's wondering, okay, yeah, all right, that's reasonable.
All in
Yeah.
favor?
Aye.
Yeah,
Aye.
okay.
There's gonna be no other business to make. a
No,
mo-
hold
there-
on, next
there
regular
is.
meeting is scheduled for
said
December
1.
1st, 2025. Any objections to that?
Nope.
Anything we want to talk about beyond what we have already discussed? Suji's Kitchen.
I can just tell you, they were requested to be present at a hearing today because they owe outstanding fines for reinspection. There has been repeated violations. We are following protocol of inspection and, so at this point, it's an outstanding fine. I can reapproach it. I mean, they were summoned, we sent them a certified letter. They got it. We got their ticket back saying they got it, so they were aware of the hearing. Permitting is coming up. My assumption is that no one gets the permit if they owe fees and fines.
Yep,
Mhm, right,
Just Okay,
Right. So do you know if the condition's been remediated?
it's an ongoing issues. This is re-inspection fee, which means we have inspected you, we told you what to fix, you have not fixed it.
It
We
still
brought that,
happened.
still haven't fixed it, you get a $75 fine. So this will just continue, so, the inspector will go back, I believe she's going back this week, so.
Okay, so is there concern that the public is at risk with this not being fixed?
It is issues of non-compliance with requirements, for managers on duty that are certified, as well as improper or no hair wear, improper shoes. There's a litany of issues. So they just keep being addressed, and at this point, I just clarified with you guys that my assumption is that no permits are given until things are rectified and fines are paid. So, it's the end of the month. It's due December 1st. Yes, Dennis?
Yeah, one of the things that, we could consider doing, and I'd make a decision tonight, is in a situation like that where there are violations, found by Board of Health inspectors of a restaurant or establishment. They may not be sufficient violations to close them down. But they are certainly sufficient violations to post a notice at the entrance of the restaurant that the restaurant is currently in violation of. You live there.
Oh, you guys want to?
And just.
I think that's a discussion.
Great to
The
add to our
public-
next
the-
agenda.
Yeah,
for
we-
discussion.
Yeah, be advised that this establishment is in violation of the following code of Board of Health requirements.
I will look into for the next meeting to see, because there's different ways you can do this.
Okay,
Well,
okay. I mean, because what's the point of having inspections?
Why-
We're not gonna,
the one
Well,
thing,
they're all
well,
public
it doesn't
record.
mean anything, you know?
it
right,
is, it
but
is a
the-
public
But this way the
record.
public would know.
Yeah, just be advised. Eat at your own
Yeah.
risk, whatever.
Yeah.
I think that would be, if I were a restaurant owner, I knew I had a choice between paying this fine or posting that.
But
at
it's
my
not
front
even
door.
just about paying the fine, how about do the right thing?
Just,
Yeah,
right.
well, these guys don't necessarily think that way, but they're thinking bottom line and what it costs. And the impact that potentially could have on my business.
Mhm.
I think
So
I,
I will come up
Yeah.
with some
Yeah.
possibilities.
Some research.
I will.
Okay.
Yes,
Okay.
Yeah, yeah.
that would be great.
public shaming.
No,
I think
like shaming, that's not what I was looking for.
Yeah, really, that's not really gonna solve a
So I
problem.
make a motion to be no other business, to conduct that we adjourn.
Okay, second.
All in favor?
Aye.
Thank you very much.